Good day, everyone, and welcome to Introduction to Research and Healthcare. And for today's session, we're going to have this topic on mixed methods research, and we're also going to discuss meta synthesis and meta analysis. Just before we start with our new topic, let us first answer these questions based on our previous topic. The question says, a nurse researcher has just completed data collection and is about to embark on data analysis. Which of the following steps represents the initial step in implementing the Colizzi method for data analysis in qualitative research? A. Collecting data from patient records and observations. B. Immersing oneself in the collected data to gain a deep understanding. Letter C. Identifying significant statements or phrases relevant to the research focus. Letter D. Formulating meanings from the significant statements through reflection and interpretation. The correct answer is letter B. Immersing oneself in the collected data to gain a deep understanding. After recording and transcribing the interview, the first thing that you need to do is to write down everything that your informants have said word for word. Now, this is called transcribing. And after that, once you have the transcript, the next thing that you need to do is to read through it carefully a few times. In other words, you need to immerse yourself with the data collected and make sure that you really understand what the person is talking about. The next question is, why is bracketing considered important in the Colizzi method of data analysis? Letter A. It helps to identify outliers in the dataset. Letter B. It allows researchers to set aside preconceived notions and biases. Letter C. It assists in organizing data into meaningful categories. Letter D. It helps in quantifying qualitative data for statistical analysis. The correct answer is letter B. It allows researchers to set aside preconceived notions and biases. As previously mentioned, bracketing is a process researchers use to set aside their personal opinions, biases, and assumptions when analyzing data, especially in qualitative research. And this is important because it helps ensure that the analysis is based on the actual experiences and perspectives of the participants rather than the researcher's own views. And by doing this, researchers can get a clearer and more accurate understanding of the topic that they are studying. Now, to start our session for today, let's try to look at this study by Salve in 2011, where he explored the leadership practices of successful school head teachers in Pakistan. As you can see on the slide, this study had three main questions. Research question 1. What leadership practices do successful school head teachers use? Number 2. Are there any common leadership practices among these head teachers? And research question number 3. Is there any difference between the opinions of head teachers and their subordinates regarding their leadership practices? Now, I want you to analyze the research questions in the study of Salve 2011. What can you observe? What can you notice? Now, based on the study of Salve 2011, to answer the first two questions, Salve used a survey with multiple choice questions and scales. These questions were focused on finding patterns and could be easily counted and analyzed with numbers. And therefore, the first and the second research question is more likely be addressed with quantitative research methods. However, for the third question, for the research question number 3, Salve wanted to understand the opinions of the head teachers and their staff, which are personal and subjective, right? So in here, He used open-ended questions that allowed people to share their thoughts in their own words. In research question number 3, you would notice that the researcher would most likely be using qualitative approach because the focus is on understanding experiences and feelings of the head teachers. Now, when a study needs both types of data, both numbers, and at the same time personal opinions, a mixed methods approach is the best choice. And by using this method, mixed method research, the author, Salfi, would be able to gather solid data to find patterns and also at the same time get deeper insights into people's perspective. So in here, mixed methods, a combination of both quantitative and qualitative research, are useful when you need to answer questions that require both measurable data and personal insights. And for today's session, these are our learning objectives. Number 1, understand the purpose of mixed methods research. Number 2, recognize different types of mixed methods designs and their application in healthcare research. Number 3, evaluate the advantages of mixed methods research. Number 4, understand the distinctions among systematic review, meta-analysis, meta-synthesis, including the respective advantages and applications. And number 5, interpret and analyze forest plot, identifying essential components such as effect size, confidence intervals, and measures of heterogeneity in the context of meta-analysis. Now let us start by defining what is mixed methods research and how it is different from quantitative research and qualitative research. Mixed method research is often referred to as third research paradigm. What does that mean? Well, when we do research, we usually think about two main ways to collect data, right? Quantitative, which is all about numbers and statistics, and qualitative, which focuses on understanding people's experiences, describing social processes, and describing how cultural contexts or factors influence actions, behaviors, and thoughts. Now, in mixed methods research, it combines both of these approaches in one study. Now, in healthcare administration, mixed methods can be very powerful. For example, you might want to know both the numbers, like how many patients are satisfied with the service, and at the same time you wanted to know the reasons behind their satisfaction, which could be more personal and subjective. By using both types of data, qualitative, quantitative data, you get a fuller picture of the situation. Now, how does mixed methods research look like? Now, mixed method studies are a bit like using two different tools to solve a problem. It includes, first, two data sets, which means that the researcher collects two types of data. One set is numbers, and the other is about people's experiences. It also involved two sets of analysis. The numbers collected from quantitative research is analyzed using statistical method, and the opinions and experiences are analyzed using thematic analysis. Mixed method studies also include mixing or combining the data. And this is the most important part of mixed methods research, in which the researcher find ways to bring together what they've learned from the numbers and from the people's stories to get a more complete understanding of the issue. Now, there are 5 main reasons for using a mixed methods research in healthcare. As early as 1989, Green et al. Suggested 5 main rationales for conducting mixed methods research. First, we have triangulation. The second one, complementarity. Number 3, initiation. Number 4, development. And number 5, expansion. What do we mean by these terminologies? When we talk about triangulation, it is the confirmation of results by different methods. Triangulation, this is like double checking your results. Now, when you use different methods to collect data, you can confirm your findings by comparing the results from each method. For example, if you are researching patient satisfaction in a hospital, you might want to collect data using survey. And at the same time, you also wanted to conduct interviews with patients. Now, if both methods show similar results, you can be more confident that your findings are accurate. That is triangulation. Now, what is complementarity? When we talk about complementarity, this means using the results from one method to make sense of or enhance the results from the other. For instance, in a hospital survey that shows many patients are dissatisfied with wait times, that data can be collected through quantitative research. You could also conduct interviews with patients to understand why, and that is the qualitative data now. The interview responses can help clarify and explain the numbers that you have collected, thus offering deeper insights into what's driving dissatisfaction. That is complementarity. Now, what is initiation? Sometimes using both methods can help you discover something new. The combination of two might spark fresh ideas, or it could lead to new questions. For example, if a quantitative survey about employee burnout in a hospital shows high stress levels, but doesn't explain the cause, conducting focus groups or interviews or qualitative research might reveal new factors, like for example, support from management is lacking, and this could lead to new research questions about how to address those specific issues. That is initiation. Now, what is development? Development, this is when the results from one method actually help shape or improve the other method. For instance, if a hospital's initial qualitative interviews with nurses reveal that communication problems are affecting patient care, researchers could then use that insights to design a more targeted survey through quantitative research to measure how widespread the issue is across the hospital system. In here, the results from the qualitative data help shape the follow-up quantitative question. That is development. And finally, expansion. Expansion means using different methods to look at different aspects of the problem. One method might give you detailed personal insights, while the other gives you broad general patterns. For example, you might use surveys, that is quantitative research, to measure the overall patient satisfaction in a healthcare setting, while conducting focus group or qualitative research to dive deeper into specific concerns, such as communication with the doctors or cleanliness of the facility. And by using both methods, you get a fuller and a more detailed picture of a situation. Now, in healthcare research, these strategies help provide a more complete understanding of complex issues, which leads to a better informed decision that can ultimately improve patient care and the overall healthcare delivery. Now, let's talk about the different types of mixed methods design. There are four types of mixed methods designs. The first, we have convergent parallel, we have explanatory sequential, we have exploratory sequential, and we have embedded mixed methods. Now, the choice of mixed methods design that you're planning to use in your research heavily depends on the research questions, research aim, and the need to gain a more comprehensive understanding of the phenomenon being studied. Now, the first type of mixed method research is explanatory sequential. Now, in this method, the researcher gather and analyze data collected from quantitative research. It could be from survey, it could be from questionnaire. And then, it is followed by qualitative data collection, such as interview or focus group discussion. Now, explanatory sequential is very useful if the qualitative data explain and contextualize the quantitative findings. When do you use it? Now, sequential explanatory is used when your numbers give you some insight, but you need more details or clarification. Hence, you conduct explanatory sequential. However, one of the most important challenges in conducting explanatory sequential is that since you're doing it in two steps, quantitative then qualitative, it can take more time and resources. And also, if the two stages aren't connected well, the result could be unclear. On the bottom part of the PowerPoint slide right now, you will see the flow chart and how to actually conduct explanatory sequential, which starts from quantitative collection of data and analysis and followed by qualitative data collection and analysis. For you to be able to have a clearer picture of explanatory sequential design, let's look at the study by Alshamari et al. In 2013 as an example of this mixed methods design. In this study, the researchers aimed to explore registered nurses' attitudes towards end-of-life care and understand the barriers and facilitators to providing high-quality care. Now, here's how they use sequential explanatory design. First, they conducted a survey with 1,293 registered nurses working in different hospitals in Saudi Arabia. In here, they used a tool called Fromelt Attitudes Toward Care of Dying Scale to measure nurses' attitudes about end-of-life care. Now, this gives them a large set of numerical data about how nurses feel about this critical aspect of healthcare. Now, after gathering the survey responses, they selected the smaller group of nurses to participate in semi-structured interviews. These interviews allowed them to dive deeper into the barriers and facilitators that influence nurses' ability to provide quality of end-of-life care. Now, the researchers used this approach because the survey gave them valuable insights into general attitudes, but the interviews were needed to explore why those attitudes exist and what challenges nurses face in practice. Now, this is a great example of how explanatory sequential design works using quantitative data first to get a broad picture and then qualitative data second to add depth and understanding. Now let's talk about the second type of mixed methods research, the exploratory sequential. Unlike with explanatory sequential, exploratory sequential basically starts with qualitative data like interviews or focus group discussion to explore a topic. And then after, it is followed by quantitative data collection and analysis, such as in a form of survey and questionnaire to confirm what you have found in the interviews. Now, this method can be used if the quantitative data tests or confirm the qualitative findings. On this slide right now, at the bottom part, you will see the flow chart where the research starts with qualitative data collection and analysis, and it is followed by quantitative data collection and analysis. Now let's try to look at the study by Liao et al. 2015, which is an example of sequential exploratory design. In this study, the researchers developed and tested the nurse-nurse collaboration behavior scale. This is a new tool to measure collaboration among nurses. Now, here's how they applied the exploratory sequential design. First, qualitative data collection. In here, the researchers conducted key informant interviews with 15 nurses using a semi-structured interview format. So basically, this is a qualitative research data collection. These interviews help them gather qualitative insights about how nurses perceive collaboration in their work. Now, the information from these interviews inform the development of the items of the questionnaire that they are creating. Now, the second step in this study was quantitative data collection. Now, after the researchers developed the scale based on the qualitative data Now, the researchers tested it on a larger group of 202 nurses. In here, they collected quantitative data by asking these nurses to complete the scale in order for them to examine the reliability and the validity of the instrument. Now, the researchers used this sequential exploratory approach because they first needed to explore the concept of nurse collaboration, and that is through qualitative methods. And then afterwards, they moved to quantitative phase to test and validate what they have found out during the qualitative phase of the research. This is an example of exploratory sequential. Just before we proceed with the next type of mixed methods research, I want you all to answer this question. Which of the following steps would you expect a researcher to undertake if they intend to conduct exploratory sequential research? A. Begin with collecting and analyzing quantitative data, followed by collecting qualitative data to further explore emerging themes. Letter B. Start with collecting and analyzing qualitative data, then use the findings to inform the development of quantitative research instrument. Letter C. Simultaneously collect both quantitative and qualitative data, and then integrate the findings to develop a more comprehensive understanding of the research topic. Letter D. Conduct a preliminary literature review to identify gaps and formulate research questions before deciding on the appropriate research methodology. The correct answer is letter B. Start with collecting and analyzing qualitative data and then followed by quantitative data. Now the third type of mixed methods research is convergent parallel. Now in this approach, both qualitative and quantitative data are gathered at the same time but analyzed separately and then brought together in the interpretation phase. As you can see in the PowerPoint, in the lower part of the PowerPoint, you can see that quantitative and qualitative data are separately collected, data are analyzed separately, but the results are merged and interpreted together. Now, when do you use it? Convergent parallel design is important when you need both numbers and detailed insights to fully understand the issue. However, the problem with convergent parallel is that combining both data sets can be tricky, especially if they don't match up, or if the results are contrary, or if there's too much data to handle. Now let's take a look at the study by O'Neill et al. 2017. This is an example of convergent parallel design. The researchers aim to predict the factors that influence nursing staff's intention towards early detection of health deterioration in nursing home residents and their ability to provide subacute care. Now here's how they apply the convergent parallel design. Now the researchers gathered both quantitative and qualitative data at the same time. They surveyed 75 nursing staff at a 94-bed nursing home before and after implementing a hospital avoidance program. In addition, they conducted focus groups to gather qualitative insights from the same group of nursing staff. After that, the researchers analyzed the quantitative and qualitative data separately. The quantitative data, which were collected from surveys, provided numerical results or insights, while the qualitative data, which they have collected from the focus group, give them more details in description and feedback from the respondents. After that, after analyzing the data, the researchers merged the findings both from quantitative and qualitative data during the final analysis. Now, this allowed them to combine the strengths of both data types to gain a more complete understanding of the factors that influence nurses' staff's decision. The last type of mixed method design is embedded mixed methods. In this method, the collection and comparison of both data types occurs simultaneously. Now, in this design, one type of data, either qualitative or quantitative, is the main focus, and the other is used to add context or depth to the study. As you can see on the PowerPoint slide right now, the first figure shows that the main study was basically quantitative research, but the qualitative parts was added to add more context and depth to the study. And the second figure, you will see that the research was basically a qualitative research, but it was complemented by a quantitative research, again, to add more context and depth to the study. Now, when do you use embedded mixed methods? So basically, this method is used when you want one type of data to lead the study, but you need the other to add more context. However, this method is a little bit challenging because the main method might overpower the secondary one, leaving out important aspect or causing biases in the research. For you to be able to clearly understand embedded mixed methods, let us now examine the study by Dos Santos et al. In 2021, which is an example of embedded mixed methods design. This study investigated the nurses' work environment in university hospitals in Brazil during COVID-19 pandemic. Now here's how the embedded design worked. First, the researchers primarily collected quantitative data through an online questionnaire with self-reporting life scale. In here, the survey was designed to measure nurses' perception of their work environment during the pandemic. The focus of the study was on quantifying how nurses felt about their work conditions, making this the main data collection method. Now, in addition to the survey conducted, the researchers also included an open-ended question to gather qualitative data in the form of written comments. This was meant to supplement the quantitative data by allowing nurses to provide more detailed, descriptive feedback on their experiences. Now, the quantitative data were analyzed during descriptive statistics, while the qualitative data were analyzed using thematic or content analysis. Now, this study uses an embedded design because the primary focus was on quantitative data, but qualitative data were embedded within the survey to enhance the findings. In here, the qualitative data add depth and context to the nurses' numerical responses, giving a fuller picture of their work environment during the pandemic. Now let's talk about the advantages of mixed methods research, which combines both quantitative and qualitative research. First, mixed methods research helps us take advantage of the strengths of both quantitative and qualitative methods. And by combining them, we can actually overcome the weaknesses of using just one approach. The second one, researchers can use all available tools to collect information, which means that they can gather numerical data through survey, and at the same time, they can also get rich data responses through interviews or open-ended questions. Next is labor and time intensive. I think this is the flip side of using mixed method research because it can take more time and effort to carry out because it involves both types of data collection and analysis. In addition to that, this type of research method requires more organization and resources. It requires more teamwork, resources, compared to using just one method. That's why you really need to plan carefully, manage the different parts of the process, and most likely sometimes spend more money. And of course, the last is occasionally the findings from the quantitative and qualitative parts of the study might not match, which can lead to some confusion. And this can happen in mixed methods research. Now let's try to answer this question. Which of the following statements is true about mixed method research? A. Mixed method research involves using only quantitative data to address research question. Letter B. Mixed methods research combines both quantitative and qualitative data collection and analysis. Letter C. Mixed methods research focuses solely on qualitative data collection and analysis. Letter D. Mixed method research excludes the use of qualitative data in research studies. The answer is letter B. Mixed methods research combines both quantitative and qualitative data collection and analysis. And now we're going to proceed with the second part of our discussion. In particular, we're going to discuss the distinctions among systematic review, meta-synthesis, and meta-analysis, including the respective advantages and application. And we're going to discuss certain concepts such as forest plot, effect size, and how are these concepts important when we talk about systematic review. Okay, to start our discussion on systematic reviews, I want you to pay attention on the slide in front of you, and you will see a funnel image. At the top, you see individual studies coming into the funnel. These are different research papers or studies on a specific topic. It could be 5 studies, it could be 10, or it could be more. As these research papers or studies pass through the funnel, they get carefully filtered looking for quality and relevance for the research question. The outcome at the bottom of the funnel is a systematic review. This is a process where researchers gather and analyze all the studies on a particular topic, summarizing the best and most reliable evidence. Now, the goal here is to give us a clear and biased understanding of what the research assesses as a whole, rather than relying on few individual studies. In other words, it's like putting together a puzzle where all the pieces or studies come together to create a complete picture. This is systematic review. In the context of healthcare, systematic reviews are really important because they help healthcare leaders make smart choices. For example, systematic reviews could provide solid facts or evidence to guide decisions on patient care, improve hospital management, and ensure resources are used widely. For example, if you're wanting to implement a new intervention to improve patient outcomes, so basically your decision would be guided by available evidence, and in most cases you rely on systematic reviews, for example. Now let's talk about the different advantages of systematic review. Now, systematic reviews have several benefits that make them really useful. First, they summarize evidence so people don't need to read through all the research themselves to keep them updated. And this is especially helpful for basic professionals like clinicians, like policymakers, who need to make decisions based on a lot of data without getting lost in the details. Now, by collating results from different studies, systematic reviews gives us a clearer picture of what the research is saying. They also reduce bias, meaning that the findings aren't influenced by the personal opinion or preferences of the people reviewing the studies, and this makes the results more trustworthy. Another advantage is that explicit methods are used, meaning the process for gathering and analyzing studies is so clear, so anyone can check how the review was done. Finally, because of the organized and systematic methods, systematic reviews lead to a more reliable conclusions, which can be trusted for making decisions in healthcare or policy. Now let's take a look at the level of evidence. At the top, you will see systematic reviews, especially meta-analysis, which are considered the highest level of evidence. Now, these reviews are like gold standard because they combine results of several studies. In healthcare administration, this is extremely important because your decisions should be based on the best possible evidence to ensure the highest quality of care. Meta-analysis, for example, can help you, healthcare leaders, understand the effectiveness of treatments, procedures, and interventions, or policies, from multiple studies. This means that healthcare administrators can make more informed, reliable decisions to improve patient care, allocate resources, and better shape policies leading to better outcomes for both patients and healthcare system. Now, systematic reviews can either include meta-analysis or meta-synthesis. How are these two terminologies are different from each other? When we talk about meta-analysis, it is a quantitative integration of studies as one piece of information based on statistical analysis. Now, meta-analysis is used when researchers are working with numbers or quantitative data. In here, the researchers combine data from different studies to look for trends or patterns. For example, if the different studies are measuring how well a treatment works, meta-analysis combines all the numerical results to give us one overall result. This is called meta-analysis. Meta-synthesis, on the other hand, is the use of qualitative research, which focuses on interviews, experiences, and words. In here, the researchers gather findings from different qualitative studies and then put them together to find common themes or insights. This is meta-synthesis. Now, what is meta-synthesis? How does meta-synthesis look like? As previously mentioned, we said meta-synthesis is a qualitative integration of individual qualitative studies. For you to have a clearer picture of meta-synthesis, I want you to look at the slide right now. Again, you will see a funnel image. At the top, you have many individual qualitative studies. Could be 5, 10, 15 or more. Now, these studies might look at things like how patients feel about certain treatments, or how nurses experience working in a high-pressure environment. All of these individual studies are separate and might have different findings, right? Now, as these individual studies move through the funnel, they go through a review and synthesis process. The data are analyzed and then combined. And then at the bottom of the funnel, you get a meta-synthesis, which is like the final picture that pulls all the different insights together into one clear understanding. Now let's dive into an example of meta-synthesis. Now, Zhang et al. 2018 conducted a meta-synthesis to explore how nurses cope with the emotional challenge of patients' death and the strategies they use to manage these feelings. Here, they conducted a thorough search of 10 different databases to gather all the relevant studies on this topic. Now, what makes this a meta-synthesis is the way they brought together findings from 16 different qualitative studies. Instead of just looking at each study separately, Zhang et al. Analyzed and combined the results to identify common themes. Now, this process of merging and interpreting qualitative findings from qualitative studies allow for a deeper understanding of how nurses cope with patients' death, thus giving us a more clear insights that wouldn't be possible from looking at just one study alone. Now let us discuss meta-analysis and how it is different from meta-synthesis. And for you to have a clearer picture of meta-analysis, I want you to look at this slide right now, where you can see a funnel image. Imagine that you have many individual quantitative studies at the top. at this point we're talking about quantitative studies, each providing data on a specific topic. These individual quantitative studies go through a funnel where they are systematically reviewed and analyzed, and what comes out at the bottom is a single combined result, the meta-analysis. Now, what is meta-analysis and how it is different from meta-synthesis? Meta-analysis is like taking the results from several quantitative studies on one same topic and combining them into one clear answer. Unlike meta-synthesis, meta-analysis uses statistical tools to merge the data from different studies to get a better overall picture of how effective something, like a treatment or intervention. Now, in healthcare, meta-analysis is super helpful because it gives us a more reliable answer, backed by a lot of evidence instead of just relying on a single study. Now, when we put all the results together, such as in meta-analysis, we get a stronger conclusions, which would help us, healthcare professionals, make a better and a more informed and sound decisions. Now, what are the advantages of meta-analysis? And why is it that meta-analysis can be found on the topmost level of the hierarchy of evidence? Now, meta-analysis provides the highest level of evidence because, first, it combines findings from multiple studies, or it is a result of integration of study findings, which makes it more objective. And the second one is that since the data collected from these individual studies are statistically integrated, this makes the results more stronger and more reliable. In other words, we're more likely to detect a real relationship between variables if meta-analysis is conducted. As previously mentioned, in meta-analysis, we use statistical tools to merge and combine the results of individual studies. In meta-analysis, we do not just combine data. It is not enough. Instead, we need to understand the true impact of what we're studying. That's where effect size comes in. When we talk about effect size, we're talking about a standardized measure that quantifies the magnitude of relationship or difference between variables of interest across multiple studies. In other words, effect size in meta-analysis means a way to measure how big or strong the effect of something is. Like, for example, you conducted a meta-analysis of a specific or certain treatment or a certain intervention. And through meta-analysis, through identifying the effect size, you will be able to identify whether the effect of such treatment or intervention is big or strong. Now, effect size helps us interpret how big or small the difference or relationship are between groups or variables across the studies. By calculating effect size, we can determine not just if something works, but how meaningful that effect is. And this is important because the effect size could help us make better and more informed decisions based on the evidence. Now, the common effect size metrics used are Cohen's d, Pearson's R, odds ratio, and Hedges G, among others. Now let's talk about the types of effect size. As we have mentioned previously, we said that effect size is very important because it helps us interpret or quantify the magnitude of the relationship between variables, such as, for example, you are testing an intervention or you are testing a new treatment. Now, the table shows the different possible effect size that you can see in a meta-analysis. It could be small, it could be medium, and it could be large based on the different measures that we use. Now, these numbers are very important because it could help us understand the strength of the relationship or effect we're seeing in the studies. For example, a small effect size means the relationship or difference is minor, while a medium effect size indicates a more noticeable difference. And of course, a large effect size shows a strong, significant relationship. Now you might ask, why is this important? Why it is very important to identify the different effect size? Now when you look at a bunch of studies, effect size can actually help you understand whether the intervention or the treatment is really working. If you see a large effect size, you will know that the intervention or treatment has a strong impact. On one hand, if the small effect size is seen on meta-analysis, it might suggest that the difference or the impact of the intervention or the treatment is not as significant. And this help you or inform your decision-making process. Now let's try to look at this specific example of meta-analysis. Now the purpose of this meta-analysis is to examine whether the use of virtual reality is effective in terms of cognitive, emotional, and psychomotor outcomes and learning satisfaction in nurses. In this meta-analysis, they have included 5 different studies from Chang 2021, Wang 2021, Poon 2016, Chai 2008, Zhang 2021. All these 5 studies examine virtual reality. Now, you will see on the table on the bottom part is the test for overall effect. And we're talking about the effect size. And the symbol for the effect size is Z, and the value is 2.53. Along with this value is the p-value of 0.01. As previously mentioned, a p-value of less than 0.05 supports statistical significance of the result. In other words, the z-value and the p-value in this meta-analysis means that there is a strong evidence to suggest that virtual reality has a positive effect on cognitive, emotional, psychomotor, and learning outcomes in nurses. And if you try to look at the forest plot, when we talk about the forest plot, we're talking about a graphical representation of the result of multiple studies. On this slide right now, you can also see the forest plot. And obviously, by looking at the forest plot, you will know that virtual reality yielded significant and positive effect on nurses because all the values, all the plots lean towards the positive means. Now let's try to answer this question. Which of the following statements best distinguishes between meta-analysis and meta-synthesis in research methodology? A. Meta-analysis involves pooling quantitative data from multiple studies to calculate summary effect size, while meta-synthesis involves synthesizing qualitative data. Letter B. Meta-analysis and meta-synthesis are two terms referring to the same process of combining data. Letter C. Meta-analysis focuses on identifying patterns and themes across qualitative studies, while meta-synthesis involves statistical analysis. Letter D. Meta-synthesis refers to statistical aggregation of data, while meta-analysis involves qualitative interpretation of findings. The correct answer is letter A. Meta-analysis, if you want to integrate the result of your quantitative data, and meta-synthesis, that is a qualitative integration of multiple and qualitative studies. For your in-class activity, the title of your activity is called Making Sense of Research Exploring Meta-Analysis and Meta-Synthesis in Healthcare. And the objective of this activity is, upon completion You will be able to demonstrate ability to analyze and synthesize information from 2 articles on meta-analysis and metasynthesis. You will be provided with 2 articles, and you are expected to answer the multiple type questions posted in Canvas. That is all for today, and I will see you on our next session. Have a good day.